So, Dr. Mohandas, tell us a little bit about yourself and your professional background.
Well, I come from a family of doctors. I'm the fourth generation doctor in my family, and my father and I are both orthopedic surgeons. Both of us trained in the United Kingdom, and both of us came back to India after our training. My father started MIOT 24 years ago, and I came back from England in 2007 and slowly, apart from being an orthopedic surgeon, took over some of the administrative roles. And then from 2014, I've been managing director of MIOT. Well, India produces a heck of a lot of very good doctors, and healthcare in India is pretty affordable. As a result of this, the countries around India started looking at India as an option for healthcare, and that's how the hospital started attracting patients from overseas, and now we get patients, a lot of patients from Seychelles.
Tell us a little bit about MIOT, the services you provide, and everything we need to know about MIOT.
Well, I think there are a lot of options for patients today to access healthcare. The uniqueness of MIOT is that the people who run MIOT live on site. So I actually live in the hospital on the 9th floor, and I visit every single overseas patient every day. So apart from providing treatment, the most important area in MIOT is satisfaction, is to make sure that everybody who comes to MIOT leaves with a smile on their face.
All right. I understand in January 2022 an eye care facility was launched. What are the treatments with regards to eye care provided in this facility?
Well, it's a massive facility. We invested over $1 million in it, and it's a partnership between MIOT International and a local entity which was previously called Visus Opticals, which was absorbed into Total Eye Care by MIOT. And we basically give the A to Z of eye care. We have a full-time ophthalmologist who can also perform surgery. We have an operating theater. We've got state-of-the-art diagnostic capability, and we have a full-time anesthetist. So it is very, very safe.
Okay. So can you please tell us, I don't know if it's okay for me to ask this question about your prices.
Right. So the prices are all designed keeping Seychelles in mind. The newest entity that we are looking at is diagnosis. In Seychelles, if you've stumbled and fallen, or you got hurt at work, if you're young or old, or you're at sea and you're repairing your boat and you hurt yourself, how do I know if I've not broken something, and how do I know whether I should worry or it will get all right on its own? So diagnosis is a big problem in Seychelles, and accessibility, which means being able to afford your diagnosis.
Yes.
So the easiest, the quickest, and the best way to diagnose anything is an X-ray. And when you want to have an X-ray done, you want to be able to see it yourself, because that's something that you like to do. You want an expert to report the X-ray and give it to you in writing.
Yes.
You want to have the X-ray with you so that you can see it at any time of the day or night. And you want to make sure that it is not too expensive for you to have this done. So we are able to fulfill all that by providing the service at 200 Seychelles rupees.
That's all.
That's it, for everything. You get the X-ray in a USB stick. You get a report virtually immediately from Chennai by a senior radiologist.
Really?
And you get the film in your hand, and you get your diagnosis. That's the price you pay in India. So our goal was to bring India to Seychelles instead of having the Seychelles need to go there.
Okay, that's really nice. So recently, MIOT Instant Digital X-ray, you were talking just now about it, a state-of-the-art technology housed in MIOT Seychelles Medical was introduced.
So this is an X-ray unit, but it's not just any X-ray unit. It's the latest and the best from Siemens, Germany, and from Germany it's been sent directly to Seychelles. Yes, it can perform X-rays, but can also look at your digestive tract, the upper digestive tract, called the food pipe or esophagus, using barium swallow, the stomach and the intestines of the digestive tract by using barium meal, and it could also follow up or track cancers by barium enemas. And not only that, this X-ray machine can also look for kidney stones via intravenous pyelograms. So it's quite a comprehensive diagnostic beast.
It is.
Yeah.
Wow. So we often hear about MIOT, and we are very happy to have you here with us today for us to better understand the services you provide. So briefly tell us a few, or maybe one of the memorable success stories that maybe you know.
So with regard to Seychelles, we've had many, many successful stories. And the great successful stories in Seychelles are the stories where somebody has had a procedure and it has changed their entire life. One such story, without naming names, a young girl who came to Chennai at the age of 12 with a severe deformity in her spine. She refused to even play any sport. She refused to go to the changing room in school. And she had lack of confidence. And she had her surgery done. Her spine was straightened, and then she went on to win Miss Seychelles. So this was a glorious story for us.
It is indeed.
Yeah.
Wow. What are the three things you love about MIOT Seychelles Medical?
Well, I think one of it is the fact that we employ a lot of local Seychellois, and it's incredible how welcoming, positive, and full of energy they are. It's a pleasure to work with them. The second, of course, is the fact that we have cutting-edge equipment, whether it's eye care, whether it's diagnosis, whatever it may be. Our focus is to try to get the best of the best and not compromise. And the third most important thing is being affordable. Whatever it is, we'd like as many people as possible to access it.
Yes, yes. Who is the founder of MIOT?
So the founder of MIOT is Professor Mohandas. Professor Mohandas is called the father of modern orthopedics in India, and he started the entity MIOT in 1987 in rented premises. But the current site, which is in 14 acres in Chennai, was started in 1999. So currently it has 1,000 beds and 63 specialties.
Okay. So what are the biggest challenges that MIOT is facing?
In Seychelles.
In Seychelles or in India?
Right. Well, I think the whole world faced a big challenge with COVID-19, but the advantage that it gave us, it taught us that medicine can be practiced even if it is difficult for the patient to come to the doctor. So telemedicine has been going on between MIOT India and Seychelles for the last 2 years, and it has developed greatly. Every patient from Seychelles who comes back from MIOT to Seychelles has a telemedicine appointment free 6 weeks after they return.
Okay.
The big challenge in Seychelles with MIOT Seychelles is that India has entered the digital age in a big way. Our internet connectivity and speed is just tremendous. And when we first started here, we found that a huge challenge, especially because everything is captured digitally. But now we're slowly sorting that out, and I think we're seeing light at the end of the tunnel.
Okay. So, Dr. Mohandas, what do you want to tell us more about MIOT before we end our conversation?
Well, I think MIOT is here to stay, and MIOT is not going to stop with eye care or with diagnostics. We're soon going to be starting ENT services. Our full-time specialist is already here. The equipment is being installed, and soon we will see even more services in place, and we're hoping soon that we can do something that's purpose-built for the Seychellois in Seychelles, hopefully staffed mainly by Seychellois.
So, Dr. Mohandas, thank you very much for coming today. Thank you so much, Doctor.
Thank you very much.